Greetings, Sen with Nepenthe here. In this video, we're going to be learning about cannulas and other disposable supplies. Nasal cannulas are the primary way in which oxygen is delivered to patients. They are available in a wide variety of sizes and types and can be used along with several accessories. These supplies in aggregate are frequently referred to as disposable supplies, or simply disposables, or sometimes soft goods. The most common items in this group are cannulas, supply tubing, connectors, and humidifier bottles. A patient's prescribed liters per minute, or LPMs, will dictate which type of disposable supplies that will be needed. Liter flows are split into two categories: standard, which includes LPMs of 1 to 5, and high flow, which encompasses LPMs of 6 to 15. High flow patients must always be provided with high flow cannulas to ensure they receive their prescribed amount of oxygen. For quick reference, standard flow cannulas and supply tubing are clear, light blue, or sometimes light green in color, and high flow cannulas and tubing are dark green. This can vary from brand to brand, but is always true of Salter Supplies, the primary brand provided by Nepenthe. Here we have a nasal cannula with attached 7-foot supply tube, frequently called a 7-foot cannula. It can be attached directly to the supply port on a concentrator, LOX portable, or regulator on a cylinder or LOX base. When attaching the cannula to the supply port, be sure to use a medium amount of force to push the female supply tube end over the male connector. Double check the connection by tugging gently on the tubing to ensure a secure fit. Nasal cannulas are worn in a patient's nose. Place the supply prongs in the opening of the nasal passage and slide them gently in. The prongs should sit just inside the passageway and should not be so far inserted as to cause the patient any discomfort. The tubing connected to the prongs is then run behind the ears to meet under the chin. If so desired, the attached slider can be used to tighten up the tubing underneath the chin to help prevent the cannula from sliding around or coming loose. This is recommended for patients with limited physical ability and for those confined to bed and wheelchair. When a greater roaming range is desired, typically with in-room concentrators or LOX bases, supply tubing and a connector can be used. Here we have a 15-foot supply tube and a swivel connector. Attach the connector firmly to the end of the cannula supply tube, then to the supply tubing. The tubing can then be attached to the supply port at the oxygen source. Just like with cannulas, most standard flow tubing is clear and high flow tubing is green. At Nepenthe, we use almost exclusively the high flow tubing for all patients. This is due primarily to the increased visibility of the green tubing, which helps to prevent trips and falls, a major concern in care settings. Here is a humidifier bottle. It is recommended for use with liter flows of 3 or more, or for any patient who experiences nasal dryness. It humidifies the air before delivering it to the patient, decreasing the drying effects of forced air flow. It works by passing the enriched air through a reservoir of water, much like a standard room humidifier. To use a humidifier bottle, fill it with water, securely seal the lid, attach it to the oxygen source, and then attach the supply tubing to the bottle's supply port. Humidifier bottles have very precise use requirements that must be followed exactly to prevent air from escaping and decreasing or eliminating flow to the patient. When filling the bottle, it is important to not overfill the reservoir. This increases the chance of water passing into the supply lines and entering the patient's nose. Not only can this be very uncomfortable for the patient, it can also decrease effectiveness of the O2 therapy and presents a health risk for some patients. For these reasons, never fill a bottle past the maximum fill line. The lid of the bottle must be screwed back on straight. If it is crooked, air pressure will escape from around the lid and will not be delivered to the patient. A raised rim is present along the top of the bottle to provide a visual reference when screwing on the lid. Make sure that the distance from the lid and the bottle rim is the same all the way around the bottle. The bottle is attached to the oxygen supply source via a threaded male receptacle, or more frequently, an adapter. Here we have the threaded on-machine receptacle. Simply screw the bottle directly to the receptacle, making sure to hold it straight and not cross-thread it while attaching. When using the adapter, attach the threaded end to the bottle the same way, then secure the other end to the supply port at the O2 source. After you have sealed the lid and attached it to the O2 source, double-check the seal by placing your finger over the supply port and pressing firmly for 4 to 5 seconds. When you remove your finger, you should hear a puff of air escape. This indicates that the seal is solid and that the only escape point for the air is through the supply port. If you do not hear the puff of air, double-check the lid seal and your connection to the O2 source for leaks. See our troubleshooting humidifier bottles video for more information. Most humidifier bottle manufacturers recommend the use of distilled water in the bottle's reservoir to prevent the buildup of residue in the bottle's lid and other connection points. This recommendation is made with the expectation that the bottle will be in use for 90 days, their rated use time. At Nepenthe, we change all of a patient's disposable supplies, including the humidifier bottle, at least once every 30 days, so this residue buildup is not an issue. For this reason, we find simple tap water an effective and affordable replacement. As part of our standard service to care facilities, Nepenthe changes all of our patients' cannulas and other disposable goods once a month or more. Supplies are stocked at your location for use when additional changes are required. Our standard setup for a resident in-room includes nasal cannula with attached connector, sometimes called a 0-foot cannula, 15-foot supply tubing, and humidifier bottle. A patient's oxygen setup should be customized for their comfort and can be adapted in many ways. The humidifier can be omitted for any patient with flows of 2 or less and/or who don't experience nasal dryness. Longer supply tubing is available for patients who require a longer roaming range within their rooms. For a patient's portable, a cannula with attached supply tubing is most often used. For ambulatory patients, a 7-foot cannula works best, while 4-foot cannulas are the preferred choice for patients in wheelchairs. A number of specialty items are also available for patients with specific needs. Here we have 2 common types of oxygen masks: a medium concentration mask, often referred to as a simple mask, and a high concentration mask, commonly called a non-rebreather mask or a reservoir mask. Oxygen masks are by order only and should only be used when indicated by a doctor. The simple mask comes with attached 7-foot supply line and is rated for use with LPMs of 6 to 10. The mask is attached to the patient via an elastic strap that is placed around the back of their head and securely tightened by pulling taut the ends of the strap on both sides of the mask. The non-rebreather mask also has an attached 7-foot line, as well as a reservoir bag which fills with enriched air from the O2 source, increasing the oxygen purity delivered to the patient. It is rated for use with LPMs of 6 to 15 but works best with flows of 10 or more. Make sure the attached reservoir bag is fully inflated before fitting the mask to the patient. It is attached in the same manner as the simple mask. This is a high-flow cannula with 7-foot supply line. It functions in the same way as the standard cannulas, but is rated for use with liter flows from 6 to 15. To ensure proper airflow, it should always be used with high-flow supply tubing, high-flow connectors, and high-flow humidifier bottles. Here we have a soft cannula. It is for use with patients who have sensitive skin. The soft, rubber-like tubing provides a more comfortable fit and is recommended for patients with sores on face or ears. Soft cannulas are rated for LPMs of 0.25 to 6. Nepenthe provides all of its care facilities with a handy guidebook that features information on all the items addressed in this video, as well as several others. This guidebook can most frequently be located along with the disposable supplies stocked by Nepenthe. Nepenthe provides a wide variety of cannulas and other disposable supplies. Proper application and use can increase patient comfort and patient and caregiver convenience. Thank you for watching, and have a great day.